Risk assessment. In one of the previous modules, we taught you how to do an initial risk assessment. You need to go around and identify every hazard, everything that has the potential to cause harm. Then you have to analyze that hazard after you've given it the right name and you've found out the right information. And you have to analyze it for the kind of incidents that may result from that hazard. You need to describe them, and not just one incident, every possible incident that you can think of. I have given you an example, 2 examples of risk assessments, and in there are several hazards. Several of those may be present in your workplace. You are welcome, when you do your risk assessments, to copy and paste those details and learn from them. Look at the detail. Look at how many of those incidents are described, and look at how much detail the kind of incident is described. If you are trying to if you're trying to educate people on how they will get hurt with a hazard, you have to be detailed. You have to give people information. You can't just tell them, be careful of this thing, it's going to hurt you. You have to tell them how and when so that they understand. You also need to describe the consequences and say, if you cut your hand in this way, your hand might be unusable forever in your life again. If this object hits you in your face or it damages your eye, you can get blind for the rest of your life. If you fall from a roof 2 meters or high and you knock your head, you may be dead, or you may be paralyzed, or you may get severe fractures in your legs, arms, and back, and so on. So you have to try and be descriptive. Then you have to do the risk rating. You can use any matrix that suits you, suits your organization, needs to fit your organization. We have spoken about that in one of the previous modules. You have to do the likelihood of the incidents happening related to that hazard. You have to do a severity rating for the incidents related to the hazard. And then you give a risk rating for the hazard, not for the incidents, because there may be 20 incidents connected to a hazard. So the risk rating is for a hazard. The next thing that we have to do is we have to put controls in place to prevent these incidents from happening. And there are several things. We do risk assessment all the time. We train our people. We give them PPE. We teach them how to use the tools and equipment correctly. We put supervision in place. We engineer things out, like we put guards in place. We have checklists to make sure that the equipment is in good condition. And those things are the documentation that is going to sit somewhere in your health and safety management system or in your SHE file, and that is the documentation that you need to update on a regular basis. What we want to see is that you can link the hazard, the control that's required to prevent incidents happening from that hazard, and how that control results in some form of documentation or control that sits in your SHE file. The checklists and the training requirements, the PPE requirements that sits in your SHE file or in your health and safety management system are not things that have just been thought out. They are control measures that have been tried and determined as effective in the past. You just need to make sure that you take the right control measure and you attach it to the right hazard, and that's what we want to see in this module. We want to see how you connect the hazard with the controls, which is the right PPE. And when you tell me PPE, I need to see what kind of PPE. Leather gloves, rubber gloves, acid-proof overall, waterproof overall, dust-proof overall, disposable Tyvek overall, safety boots, gum boots, a grinding face shield or a chemical splash shield, just safety glasses, hearing protection, double hearing protection, a dust mask, a fume mask. So you need to be specific about the kind of PPE that is required. Because if you want to train people on how to protect them against the hazard, you need to have that specific detail. So you can see when you do the risk assessment, it is definitely a level up from what we are seeing right now. Also, when you do the risk assessment, please don't do the following. And I'm going to stress that. Make sure that you don't get confused about hazards, unsafe behavior, unsafe conditions, control measures that people are not doing, like they're not wearing safety glasses or they're not following the training. Don't write the incidents. Don't tell me that the person is going to fall as a hazard. If you don't remember what a hazard is, it's a physical object or a being. Go and look at the video again. I've given all the links to the old risk assessment or to the previous risk assessment videos. So go and review them. The outcome of this exercise, of this module, is going to be a comprehensive risk assessment for your organization. And you can then take an extract, you can take a sample of the relevant stuff. If you're going to just do a job with some of the tools or only some of the hazards, then you can take a sample of this material and say, but this is the risk assessment for the next task. The quality of the risk assessments that I've seen so far during this mentoring and coaching project is extremely poor. It suffers from all of these problems which I've mentioned before. They are not specific. They talk about a chemical. We need to see the name of the chemical. We need to see the category of the chemical. And you need to go to the safety data sheet and go and look at the harm that it may do. It may be corrosive. It may cause inhalation problem. May cause severe burns. It may cause poisoning. But don't just write chemical. You need to give the chemical a name, because there are many chemicals in the world. People are confusing hazards with incidents, and they, instead of saying there's an electrical extension or something in the road, which is a pipe or a cable, they say trip and fall. Trip and fall is an incident. What am I going to trip and fall over? I need to address that. Also, the amount of detail when people can foresee these incidents: angle grinder, disc breaking, entering your skull, pieces shattering, pieces flaking off and entering your eye at high speed, the sparks creating a potential fire or ignition source, hands getting cut, machine biting into the material and jerking a person, causing muscle sprains and injuries. I don't see that in the risk assessments. And it's often because the people that are doing the risk assessments do not employ or do not co-opt the other people with the technical knowledge, and then the person with the risk assessment, doing the risk assessment, does not have the technical knowledge. If you don't have the technical knowledge, you cannot do a proper risk assessment. So please involve people with the right technical knowledge so that we can use the right names for the equipment and do the right descriptions. The assignment that is going to come out of this will be issued, but basically you will have to submit your organization's risk assessment to be able to pass this module. It's one of the first applications of the theory that we've been teaching, and it's one of the most important, it is the most important part of your health and safety management system. So please do it correctly. If you don't know exactly how, if you've got problems, see the on-site coach, and he will help you to put the detail in and to understand it on a person-to-person basis. Good luck with this module.